Dr. Usman Ahmad, who is the Department Chair in the Thoracic Surgery, Heart, Vascular and Thoracic Institute. Dr. Mitesh Badiwala, Surgical Director, Heart Transplant, Staff Physician and Cardiac Surgery. Dr. Feras Bader, who is a Director, Section of Heart Failure and Transplantation. Dr. Fadi Hamed, who's a Medical Director of Lung Transplant. And they all, of course, as I said, represent Cleveland Clinic Abu Dhabi. And my first question might be to say is, who's taking over your jobs while we have all of the best experts here with us? Okay, it gets a bit of a chuckle. A big round of applause to our panelists for joining us here today. Dr. Usman, welcome back to the stage. We had a fascinating panel discussion yesterday, and I'm going to begin with you. Let's just set the scene. Some people might be new to this particular area, and others, of course, are our learned and esteemed audience members. When it comes to heart and lung transplantation, take us through a brief history lesson, if you may. Where were we and where are we at now?
Thank you, Mandeep. Assalamu alaikum, everyone. Good evening, afternoon, I guess. Let me pause the conversation here for a second and put things into perspective for those of you who are not intimately involved in taking care of heart and lung patients. From the moment we're born, the first sign of life that happens in a human being or any living organism is that the heart starts beating and they take their first breath. That is how life starts. We're here talking about people, family members, and friends and so forth, whose hearts and lungs are so bad and so sick. And I'm going to pause again because this is a very solemn moment for all of us who are involved with these human beings. We have people who are so sick that by all statistical measures, they're looking at a few months down the line and they cannot look beyond that time period. And this is the population of patients we're trying to work with. These are the human beings we're trying to salvage. And it may seem to you that these are 70 and 80-year-olds, but they're not. We have 30-year-old engineers who have lost their jobs and incomes because their heart's not working or their lungs are not working. We have moms who just gave birth to babies and their lungs failed and they need new lungs. We have 15, 16-year-old teenagers who've had bad infections. Corona came through all of this and increased the number of patients who needed these services. So this problem is about as big as it gets. We're very privileged to be given the responsibility and the ability to take care of these human beings who are really suffering with these bad problems. And we're all here, in this shiny auditorium talking about this, but the reality is that this is a grave problem, and the responsibility is incumbent upon us to try to do our best to help these people.
Absolutely, and I think on that note, Dr. Usman, I'm going to come back to you in just a moment. We have a video which I think might set the context for our audience members and allow you.
I want to add something to that, but yeah, let's
let's play the video and then we can add to that point. Fantastic video, yes. That definitely deserves a round of applause. And the reason to bring in the video at that particular point, I think it really echoes, it mirrors the points that you're making there, Dr. Usman, just showing the gravity of these operations that we're speaking of. Do continue, and then I'm going to bring in the rest of our speakers.
Thank you. You know, the gravity of the disease and the situation is as bad as it is, but this conversation will be incomplete if I don't highlight the fact that the people who are looking after this country are very vigilant, and they're very smart and making the right moves at the right time. We wouldn't be here talking about providing these really, really complex operations that are done in select places around the world. People have to travel thousands and thousands of miles to go get a heart transplant or a lung transplant. But we're here today talking about the fact that we are successfully doing this in the middle of the UAE. Our CCAD leadership, our M42 leadership, the country's leadership is to be thanked for making this happen. To bring the expertise together, to bring the technological advances together, to bring all of you together here to talk about this, to highlight these facts is what we are thankful for, because we have been given the privilege to save these lives, and we are very thankful to be in that place.
And we're very privileged to hear about how you are saving those lives. And you allow me to seamlessly bring in Dr. Mitesh on this point. You talk about bringing in the international experts from around the world and the UAE providing this very unique ecosystem to operate in. Dr. Mitesh, very complex operations. Speak to us about building the teams to carry out these operations.
Yeah, so I think that's what's fundamental. You need a team. None of this can be done by any one individual. It has to be a team effort to take care of these incredibly sick patients, as Dr. Usman has described. These are patients who are on the verge of essentially dying. And so to come in and provide these advanced services obviously is a team effort. Now, when it comes to building a team, this is a process that fundamentally starts with medically managing these patients before they even get to complex surgeries. And so when I was asked to join Cleveland Clinic Abu Dhabi, the first question I asked was, what's the current team? And I was able to come visit with Dr. Feras, who himself, over a number of years, had built that incredibly advanced heart failure team. Because I knew that if I were to join this team, I would be one piece of the puzzle. You know, the piece of the puzzle that would take it to the next level, obviously, but relying on that foundation. Because if I was recruited as an advanced heart failure surgeon doing transplants and mechanical pumps, without a team to help manage the patients, to select the patients, to work with, I would be alone, and this would not lead to any successful outcomes. And so when I came and looked at what was available at Cleveland Clinic Abu Dhabi, given the resources that were provided, I was impressed right away. Here we have a heart failure cardiologist with many, many years of experience in North America, aligned with my clinical practice in Canada. And I was able to come and seamlessly integrate with that team. And so I think it takes time. It takes time to evolve a team. It takes time to build that team. But when you provide a service that is in its infancy with low numbers, you need to bring in people with that expertise. And I think having been in Canada in independent practice as the Director of Heart Transplant at Toronto General Hospital for almost 10 years, I came in with that experience, but importantly with a team that was experienced. And so for me to come in to provide that heart transplant surgery and LVAD surgery and whatever comes next, total artificial heart technology, is easy when you have that team, a group of aligned individuals who are committed to doing whatever it takes to take care of these incredibly sick patients.
Absolutely. And Dr. Mitesh, we appreciate you giving us that insight. I'm going to bring in Dr. Feras, as you have expertly, Dr. Mitesh, I feel like being my co-host, because you've given a wonderful introduction. You all bring such incredible expertise. Dr. Feras, give us your perspective on building that team, what it was like beforehand. Again, let's really emphasize that here in the UAE and especially in Abu Dhabi, what was available beforehand in terms of expertise and this actual facility, and also just give us that human touch of people had to travel very far. This has made a huge difference to people's lives.
No, thank you very much. This is actually a great segue into what I was going to talk about, which is, again, the importance of the multidisciplinary team. Every time we have a discussion like this, I feel it would do great injustice to members of our multidisciplinary team, because we are here representing a sample of the hundreds of people who work to make this a successful program of multi-organ transplantation. And when it gets to a point where you're doing a combined heart and lung transplantation, you're talking about the most sophisticated, most complex of operations, of programs at the level of even the most advanced centers in the world. And you know, when it comes to building any program, you have the elements of the equipment, you have the elements of the space, you have the elements of training. And if you think about it, many places can have these things together. But what's very difficult to assemble is the skilled team. Members of the team represent the strategic, most important resources in any program, because these are the rare elements to gather from different places around the world with the right amount of expertise, with the right formula to integrate within a complex team. And they're inimitable in the sense that you can't have them in many other places. That's why when you look at a region like the region we live in, I'm not talking about just the Gulf region. I'm talking about what the WHO classifies as the Eastern Mediterranean region, a region that extends from Morocco all the way to Pakistan, a region with a population of 750 million people. That's double the population of the United States. You'll find very, very, very few programs like the program we were able to assemble at this stage. And it took a lot of effort, a lot of collaboration, but it also is not a team of physicians only. It's pharmacists, it's nurses, it's technicians, it's administrators, it's dietitians, it's physical therapists. Hundreds of people, literally, that this stage would not be able to hold even if they were standing shoulder to shoulder, to make this a successful operation when you end up with a heart and lung transplantation in a young patient who walks out home.
And I think that's really interesting to emphasize that point of the whole team, as you say, the multidisciplinary team. You're being very generous in ensuring that everybody is congratulated on this journey. Now, Dr. Fadi, we've heard about setting the scene, we set the context in terms of how revolutionary this is in the region. The actual very small numbers of people who have this level of expertise across the region, as Dr. Feras has just outlined there. Now we're in a position where we have international patients actually visiting the UAE, visiting Abu Dhabi for this. Give us an insight in terms of this.
Absolutely, absolutely. Let me just add one quick thing.
Yes, just mic all the way.
Yeah, it's the team as to how much we're passionate about what we're doing. I can tell you, being a transplant physician, a transplant pharmacist, transplant surgeon, you have to be available 24/7. So I know at 3 a.m. in the morning, if I need to call Usman or Mitesh or Feras, all those people will be ready to get the call at 3 a.m. in the morning. We wake up, we look into the labs, the imaging, the test, and everything just to secure that our patients are safe and get the quality of care they deserve to. Going to your question, so the journey started with doing the transplant, right, locally in here, but because of the success of the team and the outcome, we put Cleveland Clinic, M42, and actually UAE on the map. Within a few months, we started getting calls from international patients. When I say international, Feras mentioned, a 750 million area in the Middle East up to the North Africa. I can tell you the last consult we got was for a patient from Ecuador. We had a patient who came to us from Morocco. We had patients from South Africa. So we really were able, within a short period of time, and just because we're providing the care that everybody needs in a region that providing that kind of quality of service with easy access, with great outcome. Like, this is exactly what everybody wants to be provided the care for a service that's provided with an outcome that would match it anywhere in the world that may he not even have access to it. And this is where all the teamwork came in. And this is where, over the last 2 years, I'm talking about 50 lung transplant that we have performed at Cleveland Clinic Abu Dhabi. I'm proud to say that 50% could be of those are international patients who had access, who had otherwise lost their lives. We're talking about kids, adults, parents, mothers of kids. And because of that collaboration and work and team effort, and again, the availability of organs to provide the care for those patients and for them to survive. And this is where we always mention, Hayat program that have been providing us with the success. Whatever we are here, without the presence of an active organ donation program in the UAE, because of the mindset of the government, of the leadership, of the healthcare system in Abu Dhabi, because of those people, we are able to provide that service. And this is, I'm talking about somebody who has lost his kid, his parent, his wife, and now they're offering generously the lung, the heart, the liver, the kidney, and they're seeing them surviving and giving hope to other people who are in need. All this together make us proud, and all of this together make us more determined to go beyond, and we'll talk about maybe more innovation that we can provide in the near future for our patients here in the region.
You're a mind reader. That's exactly where I want to go to next. This has been very comprehensive for us to get insight in terms of what was happening in the past, what was not available, the present day, and as the video really emphasized, all the revolutionary operations that are taking place here. So now let's cast our eye to the future, shaping the future of organ transplantation as our session is focusing on. Dr. Fadi mentioned there that key word, innovation. May I ask you all to give us an insight in terms of innovation and then ask our audience to have their questions ready. We'll try and come to you in a moment.
I'll kick off. So before I go to innovation, I'll just echo what Dr. Fadi pointed out. None of this would be possible without the selfless donation, sacrifice of donors' families. So whoever we are, wherever we are, whichever religion we follow, I would request all of you to say a prayer for all the donors who've contributed to saving many lives in the region.
I think that deserves a big round of applause to the donors, to the donors. And it's a good call to action as well, actually, that one should reflect on.
I actually also wanted to make two quick comments.
Okay, but we do want to talk about innovation because we've only got a few minutes.
Just two quick things to highlight. First of all, it shouldn't be taken for granted that international patients can have transplantation in any country. This is very unique here. Most programs around the world would not accept international patients. One of the most unique things about UAE and our program in Abu Dhabi is that we welcome patients from all over the world to get transplanted. Donations are happening from all nationalities. Transplantation is happening to all nationalities. This is very unique. People are surprised when we tell them this from all continents. This is one important factor. The other important point I wanted to make is the impact that establishing these programs had on patients here who used to travel abroad for transplantation and wait away from their families for months. I told you before we had the panel discussion that I came across a recently written book by one of our patients who went and had heart transplantation in the US. A book is written in Arabic, but it's fascinating because he describes in deep details his feelings, even his dreams, as he waited for 1 full year to have that heart transplantation done in the US, and then waited for another year after heart transplant while he received the post-transplant care before he was able to see his family and friends again, including his kids. This is unbelievable when you think about it compared to how we now were able to have these operations here, have patients among their friends and their families, and walk home within a week or 2 weeks to be back to their normal lives without a change on their social and, of course, psychological status.
You're absolutely right to put the spotlight on that in terms of the psychological impact, and certainly to share that book, who is a really good recommendation. Please do look it up. So now let's build on what Dr. Feras is speaking about there, and innovation. So how innovation is allowing people to actually stay close to home.
So we're part of an organization that focuses on innovation, that focuses on using the latest in technology and the latest in expertise and putting it together. When it comes to specifically to heart and lung transplant, we're looking at, first of all, every standard of care, state-of-the-art operation that you can think of, we have it in Abu Dhabi. So we are at the cutting edge of heart and lung transplantation in the world. Moving forward, we're looking at specific technological advances that will allow us to take organs, preserve them, transport them over longer distances so that we can actually get donors from longer distances or send organs to donor who are further away, as we do with many of our partnerships with other countries, to increase the number of lives we can save and the number of organs we can use. So these are technological advances that, as I said yesterday, stay tuned to the M42 CCAD social media outlets, and you'll continue to hear more about them.
We're really excited for that. It's a good sneak preview. Thank you, Dr. Usman. Dr. Mitesh, an insight in terms of innovation.
Yeah, like everyone has said, we're motivated and encouraged to innovate as much as possible. And M42 is the ideal organization to work for as part of its aim is to be a world leader in innovation. When it comes to heart failure, there's a lot of new innovations coming out. We've always had left ventricular assist devices to assist us. These are pumps that we implant in patients to keep them alive, to let their other organs recover while they await transplantation, or for patients who are not candidates for transplantation to have these pumps improve their quality and longevity of lives. Now we're on the verge of having total artificial heart technology that's currently in clinical trials in different parts of the world. And we are committed to bringing this technology to the region. And we are committed to doing total artificial hearts, essentially. That's on the organ replacement side. On heart transplantation, as Dr. Usman has mentioned, there are different technologies available to optimize organ quality, optimize our ability to go far distances to retrieve organs, and we are actively engaged in bringing that technology to the region to improve the outcomes of heart transplantation, to improve the numbers of heart transplantation, and at the end of the day, to respect every family's wish to have their qualified loved ones' hearts be utilized for heart transplantation. Because the sad reality is there may be a lot of potential organ donors that their hearts go unused for a variety of reasons. Distance, the organ quality itself. There are ways of actually, outside of the body, resuscitating hearts in machines that are available. That was what my lab back home was working on, ways of improving heart quality outside of the body. And so all of these innovations will come, and we are committed and prepared to utilize them here.
That's fascinating.
Let me give you
and
a quick
I do appreciate you coming
new
back.
update also from the innovation
Yes.
we're using for the lung. And maybe a small secret a lot of people don't know, when we're matching the donor and the recipient, we don't use their weight, we don't use their age, we use their height. So this
Their
is something
height.
very important for us to match the size. And everybody talk about AI now, right? So this is something we're working with, our radiology department to match the size of the lungs of the donors and the recipient using AI, technology to match the size, make sure that not just using the height itself as a height, but the size actual reconstruction dimension of the lungs itself will fit in the recipient using certain technology, using AI as standard by, radiology program. Also, something we face a lot in the transplant patient after the transplant is rejection, right? Having kind of the body attacking that, organs. And right now we still use techniques using bronchoscopy, what we call pulmonary function test, but there's a lot of new blood tests, what we call cell-free DNA, for example. So there's no new modules and technology that we're also trying to acquire to identify rejection early on with a simple blood test that help us early on intervene. So all of these are things that right now we've finished the phase that's called of startup, and let's move to the more innovative, advanced, and really technology where we can provide fast, quick intervention, action, and intervention so that we can also have better outcome.
It's wonderful to hear about the vision going forward. I do really appreciate you pointing that out, and that very sober reality of sizing things up accurately using AI. And Dr. Feras, if I may give you the final note for this session, innovation and looking ahead to the future, shaping the future of organ transplantation.
I think what we've seen until now through the achievements that have been made over the past 10 years show us that the sky is the limit as far as achievements for the future. I think we're going to stay ahead of the curve when it comes to medical innovation, when it comes to incorporating new technologies and genetic studies to kind of have the best outcomes in our patients. I think we're going to involve AI in what we do to have the best outcomes post-transplantation through proper matching and proper adjustment of medications after transplantation to balance between the risk of rejection and the risk of over immunosuppression, which can lead to other problems. But I truly feel very optimistic about this core, which will continue to innovate and develop to achieve the best outcomes, not just for Abu Dhabi or UAE, but for the entire region.
And I want to end on that note of optimism, because I don't think we can beat that note. It's a wonderful insight that you've all provided, and I do appreciate this is a very sobering reality. It's a very grave issue, but to hear about the innovations that are happening here in the UAE, that are happening at Cleveland Clinic Abu Dhabi, we are privileged that you've taken time out of your busy schedules to give us this taster. I know that we've only scratched the surface, so I think it's beholden to me to say, please return to the M42 main stage. Keep us posted on new developments and updates. Dr. Usman, I think, has already booked you all because there's an exciting, preview of what's to come. And we love to end on that note of optimism. Thank you, gentlemen. Your expertise is really of value to us all. My esteemed audience, please give them a big round of applause. Thank you so much.